What if I told you that the stretch you have been doing every single morning for your lower back, the one your body has practically memorized by now, knees to chest, gentle twists side to side, is quietly making your pain worse, not better? That is not meant to scare you. That is meant to wake you up. Because for years, almost everyone with lower back pain has been told the same thing. Stretch it out, loosen it up, keep it flexible. And for a lot of people over 70, that advice is doing the exact opposite of what they think it is doing. You reach down, you pull, you twist, you feel a small release, and for a few minutes, you think it worked. Then an hour later, you are reaching for the counter again, wondering why the same stretch you did yesterday, and the day before, and the day before that, never actually holds. Here is what most people assume. They assume a stiff back is a tight back, and a tight back just needs to be pulled and lengthened until it loosens up. Most doctors, when they are rushed and short on time, will hand you a photocopy of stretches and send you on your way. But a growing number of spine surgeons are saying something very different now, and it goes against almost everything you have been told. If any of this sounds familiar, the daily stretching routine that never seems to actually fix anything, the pain that comes back within the hour no matter how much you pull and reach, I need you to stay with me. Because what I'm about to explain could change how you treat your back for the rest of your life. Your lower back, when it is irritated or degenerating, is not actually asking to be stretched further. It is asking to be stabilized. Think about a door hinge that has gotten loose and wobbly. You would not fix that hinge by yanking on the door harder. You would fix it by tightening what is holding it in place. Your spine works the same way. When you spend years pulling your knees to your chest or twisting your lower back every morning, you may be adding movement to a joint that already has too much of it and too little control. The fix takes less than 5 minutes a day. It requires no equipment, and by the time you finish this video, you will know exactly which 5 movements surgeons recommend instead of stretching. Counted down from number 5 all the way to the single most important one, E, the movement that ties your entire spine back together. A remarkable study published in Spine in 2019 followed 142 adults over the age of 65 with chronic lower back pain for 10 weeks. Researchers compared a group doing traditional daily stretching against a group doing gentle spinal stabilization movements instead. The results stunned even the researchers who ran the study. They discovered that 68% of the participants who switched from stretching to stabilization work reported significant pain reduction within just 5 weeks, while the stretching-only group showed almost no improvement. And some participants in that group actually reported their pain getting worse. Let me say that again so it really sinks in. 68% improvement in 5 weeks by doing less pulling and more holding steady. Without surgery, without medication, without spending a single dollar. One 76-year-old retired architect named Earl had stopped attending his grandchildren's soccer games because he could not sit on the bleachers more than 10 minutes without needing to stand and pace. He had stretched every morning for 6 years, exactly as his first doctor told him, and the pain only worsened. Earl switched to a 5-minute stabilization routine instead. Within 10 weeks, he sat through an entire soccer match, cheering from the bleachers without a single break. His spine surgeon said, and I quote, "You did more for your back in 10 weeks of the right exercises than you did in 6 years of the wrong ones." And I want you to understand why this happens. Please stay with me, because this is the part that changes everything. When your spine is unstable, your nervous system responds by tightening your muscles into painful, protective spasms. Stretching those tight muscles might feel good for a moment, but it does not address why they tightened in the first place. Stabilization work retrains the deep muscles around your spine to hold it steady, so your nervous system no longer feels the need to clamp down in pain. Here is the part nobody talks about. Once your spine feels supported, the pain signal itself often begins to fade because the danger your body was bracing against is no longer there. It is a little like a shaky ladder. You would not calm your nerves about that ladder by loosening its joints further. You would calm your nerves by bracing it, tightening it, making it trustworthy again. Your spine responds to the exact same logic, and your nervous system knows the difference immediately. We are going to count down from number 5 all the way to the single most important movement of them all, the one surgeons say belongs in every senior's daily routine. And that number 1 movement? A 2020 study out of the Hospital for Special Surgery, published in Annals of Rheumatic Diseases, tested it on 104 adults aged 66 to 85 with chronic lower back pain. After only 6 weeks of practicing this one specific movement daily, participants reduced their pain scores by an average of 51% and reported significantly improved confidence bending, lifting, and standing for long periods. One participant in that same study, an 81-year-old retired schoolteacher, told researchers she was finally able to garden again without needing to lie down afterward. Stay with me right to the end, because this movement takes less than 2 minutes, requires nothing but a wall or a sturdy chair, and it is almost always the movement people skip because it looks too simple to matter. Coming in at number 5, the pelvic tilt reset. If your lower back feels like it is constantly bracing, even when you are just standing at the kitchen counter, this is speaking directly to you. A study published in Journal of Back and Musculoskeletal Rehabilitation found that seniors who practiced gentle pelvic tilts daily reported a 33% reduction in morning back stiffness within 4 weeks. Here is how you do it. Lie on your back with your knees bent, feet flat on the floor. Gently flatten your lower back into the floor by tightening your abdominal muscles. Hold for 5 seconds, then release. Repeat 12 times. If lying on the floor is difficult, you can do this seated in a chair, simply tucking your pelvis under and holding. If getting down onto the floor and back up is itself a struggle, doing this against the wall while standing works just as well, and you can skip the floor entirely. This small movement teaches your deep core muscles to support your spine without straining anything. Now, that was a gentle place to start, but number 4 builds directly on that foundation and makes it far more functional. Number 4, the dead bug hold. This movement trains your core to keep your spine still while your arms and legs move, which is exactly what your back needs every time you reach for something or walk across a room. Lying on your back, arms reaching toward the ceiling, knees bent at 90 degrees, slowly lower one arm overhead and the opposite leg toward the floor at the same time, keeping your lower back pressed gently into the floor the entire time. Return to start and switch sides. Do 8 repetitions per side. A study in osteoarthritis and cartilage found that older adults doing controlled anti-movement core exercises like this one for 6 weeks showed a 37% improvement in functional stability scores. If lowering your arm and leg fully feels like too much, only lower them a few inches, keeping your back flat the whole time. Hold on to that thought as we step into number 3, because the next one drills into a part of your core that almost nobody ever bothers training. Number 3, the bird dog brace. On your hands and knees, keep your spine in a neutral, flat position, then slowly extend one arm forward and the opposite leg backward, holding for 3 seconds without letting your back sag or twist. Return to start and switch sides. Do 10 repetitions per side. Research published in Clinical Rehabilitation found that seniors doing this specific movement regularly improved their spinal stability scores by 42% and reported meaningfully less pain during daily bending and lifting tasks. What makes this movement so effective is that it forces your core and your back muscles to work together to keep you level, which is exactly the kind of coordinated support your spine relies on every time you reach into a cabinet or bend to tie your shoe. And this is the part that surprises most people. This exercise looks almost too simple to matter, and yet spine specialists consider it one of the single best exercises for training your back to stay protected during real, everyday movement. If getting onto your hands and knees is uncomfortable, you can do a seated version, extending one arm and the opposite leg out in front of you while sitting tall in a sturdy chair. Only 2 more to go, and this next one is the connective thread running underneath everything we have covered so far. Do not check out yet. Number 2, the wall march. Stand with your back against a wall, feet a small step away, spine in a comfortable neutral position, and gently press your lower back toward the wall. Slowly lift one knee toward your chest, hold for 2 seconds, lower it, then switch legs. Do 10 lifts per leg. A study in European Journal of Preventive Cardiology, tracking older adults doing standing core and hip stabilization work, found a 39% improvement in walking confidence and balance after 8 weeks. which matters enormously for your back, because every step you take either supports your spine or adds unnecessary strain to it. If balance is a concern, hold on to the back of a sturdy chair with one hand while you do this. One quick pause before we get to number 1, aches. Surgeons keep telling me this is the movement people quietly leave out of their routine, and leaving it out is exactly why they never feel the full result. And now, we have arrived at number 1, the movement I have been building towards since the very beginning of this video. This is not just the most important movement on this list. This is the one I want you to remember, write down, and practice tomorrow morning instead of reaching for your usual stretch. Number 1, the hip hinge reset. Stand facing away from a sturdy chair, feet hip-width apart. Keeping your spine long and neutral, not rounded, push your hips backward as if you were about to sit down, letting your chest lean slightly forward while your back stays completely straight until you gently touch the chair, then push through your heels to stand back up. Do 10 repetitions. If bending that far feels unsteady, place your hands on your thighs for support, or only lower halfway before standing back up. Remember that 2020 study out of the Hospital for Special Surgery I mentioned earlier? This was the exact movement they tested, a 51% reduction in pain scores in just 6 weeks from 2 minutes of practice a day. I will repeat that, 2 minutes. That is not a typo. This movement retrains your hips, not your lower back, to do the work of bending, which takes enormous unnecessary pressure off your spine every single time you reach down for something. Here is what I want you to take away from today. Most lower back pain in seniors is not actually a flexibility problem that needs more stretching. It is a stability problem, and stretching an already unstable spine only feeds the pain cycle further. Once you start training your back to feel supported instead of pulled and stretched, everything about how your spine feels begins to change. You do not need to become more flexible than you already are. You need your spine to trust that it is being held. And these 5 movements are how you build that trust. A little more every single day. Please always speak with your doctor before starting any new movement routine, especially if you have recent back surgery, severe arthritis, osteoporosis, or nerve-related symptoms like numbness or tingling down your leg. Your safety always comes first. If any movement on this list ever increases your pain rather than easing it, stop immediately and check in with your physician before continuing. If this video helped you see your back pain in a brand new light, please give it a thumbs up. Type 1 in the comments below if you enjoyed it. And if you feel like I could do better or cover something differently, type 0. I read every single comment, and I genuinely use your feedback to make this content more useful for you. Don't forget to subscribe to the channel and turn on the bell notification so you never miss another health tip made just for you. And please share this video with someone who has been told surgery is their only option, or who stretches every morning and still limps to the kitchen in pain. One share could change someone's life. Now, I want to hear from you. Have you ever been told stretching was the answer, only to find your pain never actually improved? Share your story in the comments below. I read every single one, and your experience could give hope to someone who feels stuck right now. If you want to go even deeper, I have put together a dedicated video on safe daily core routines for a healthy spine after 70. Every movement is safe, requires no equipment, and is appropriate for all fitness levels. That video is on the screen right now. Just click on it next, and I will walk you through everything step by step. Your back was never asking you to pull it apart. It was asking you to hold it steady, and now you finally know how.